Decreasing hospitalizations and preventing death, a new COVID treatment is getting results against the evolving variants of the virus. Only News 4's Emma Hogue spoke with patients and doctors about the trailblazing treatment.
So far, about 500 patients have received the monoclonal antibody treatment through BJC, what doctors are calling a game changer and a critical component in saving lives.
To hear those words, you actually could die from this because I have those underlying factors. It scared me.
55-year-old Diane Salmo is a breast cancer survivor. She also has diabetes, asthma, and a compromised immune system. Salmo dodged the virus for nearly a year until last month.
My whole thought was, what can I do to treat my symptoms and hopefully bypass any admissions to the hospital or any long-term effects of COVID.
The following day, Salmo got a call from her doctor and agreed to try a new monoclonal antibody treatment. She sat in a room like this for the hour infusion. The treatment is used on high-risk patients to keep the virus from multiplying.
The fact that I could get there within 6 hours, receive the treatment, and say there was a little bit of hope is what made me happy.
We thought it was important to bring this treatment to the community.
Dr. Jarreth is co-leading the monoclonal antibody treatment at BJC. People 65 and older or those with comorbidities like obesity, heart disease, and compromised immune systems see the biggest benefits. If treated early, Jarreth says monoclonal antibodies can reduce hospitalizations by 70%.
We think that you need to treat about 16 patients to keep one person out of the hospital. So the more people we can treat, the more people we can keep out of the hospital.
Doesn't mean that you're not going to get better immediately. The key is that you don't get worse. And that's the key.
Dr. Kenneth Remy calls the treatment undeniably effective. Tonight, early studies show the therapy protects against certain variants of the virus, first originated in the UK and South Africa. Saturday, Missouri reported its first case of the UK variant in an adult from Marion County in the northeastern side of the state.
To be honest with you, I suspect that we may even hit another peak coming up in the upcoming months with this virus. I think this will be pivotal to save lives.
I honestly think it was a factor that helped me not have a more severe case of COVID.
Nearly a month after her diagnosis, Salmo is feeling back to normal, counting down the days until she can see her family again. A milestone she may not have met if not for the therapy.
That could save you time from being in the hospital and even save your life. And that's what is amazing.
So the key is getting this treatment as quickly as possible after testing positive for COVID-19. Right now it's being offered at 4 BJC locations. If you're interested, you're asked to first contact your primary care doctor. Reporting in the Central West End tonight, Emma Hogue, News 4.